Welcome back to campus. I am Amanda Gibson, one of your DJUSD school nurses. This video explains first aid assessment for COVID-19. Since the beginning of the coronavirus pandemic, public health experts and your school nurses have outlined hand washing, face covering, physical distancing, and staying home when sick as the most effective strategies for reducing the spread of COVID-19. We are planning to put these healthy practices in place as we reopen schools. COVID screening starts at home. We're asking all staff and students and families to screen at home using the daily illness screening checklist and only attend school if they're feeling well. Please review the self-screening for illness video available on the district's staff health and safety training webpage for guidance on self-screening. Screening at home includes assessing for COVID-related symptoms for yourself and anyone in your home, taking your temperature, and considering if you have been in contact with someone with COVID-19. Keep in mind that some symptoms may be due to allergies, asthma, influenza, or the common cold. Anyone with new symptoms of illness or family members with new symptoms of illness is expected to stay home. COVID screening continues throughout the school day in the classroom. When students arrive to class, please visually check for signs of illness. This classroom screening flowchart is provided in your classroom for guidance. If the student looks well, alert, healthy, not coughing, please let them into your classroom. If the student is ill, place a surgical mask over the cloth face covering that they're wearing. Keep the student physically separated from the others and call the school office to request further assessment of the student. If a student develops COVID-related symptoms such as a cough or runny nose while at school, staff should place a surgical mask over the cloth face covering that the student is wearing. Call the office to report the student's symptoms and send the student to sit in the first aid tent. When a student is sent to the first aid tent, a designated staff will go out to assess the student. When assessing a student, the designated staff member should sanitize their hands, wear a surgical face mask that can be worn over the cloth face covering, and we advise wearing a face shield. Other personal protective equipment such as gloves and a gown may be used as desired. For guidance on how to safely put on and take off personal protective equipment, please review the PPE training on the district's staff health and safety training webpage. When a staff goes out to the first aid tent, please bring a non-contact thermometer, hand sanitizer, a pen, a daily illness screening checklist, and student medication if applicable. When speaking with a student at the first aid tent, remember to keep the conversation outside and maintain at least 6 feet of distance. Staff should begin by filling out the daily illness screening checklist and asking the student if they have any of the COVID-19 symptoms. This form will go home with a student. COVID-19 symptoms can mimic those of other respiratory conditions. If the student has medication for allergies or asthma and there are medications on site, staff should administer medications in the first aid tent and wait 10 minutes for a response before deciding whether to send the student back to class or home. All medication administration trainings are located on the district staff health and safety training webpage. After assessing the student for symptoms and exposure, staff will take the student's temperature using a non-contact thermometer. This is a low-risk activity because staff will be wearing personal protective equipment, actions are taking place outside, and the student will be within arm's length for a very brief period of time. Although we are interested in whether or not a student has a fever for screening, a fever is not necessary for sending a student home. If the student has any symptoms of COVID-19, they will go home. However, knowing if they have a fever helps determine how many days a student must be out of school. If you are taking a temperature reading, please familiarize yourself with the use of your particular thermometer model. Please complete the Health Services staff training on non-contact thermometer use at the DJUSD website. If a student is sent home due to illness, Please notify the school nurse, who will follow up with the family and advise of next steps. The student who is going home should sit in the first aid tent until the parent or guardian comes to pick them up. The student should not come inside any school buildings. If the student is young, an adult must be outside to supervise the student. For older students, staff may monitor through the window. Before the staff person who assesses a student goes back inside a building, they should remove their protective equipment and sanitize their hands. It is recommended to also wash hands with soap and water as soon as possible. The front office staff may sign out the student without the parent entering the building, as long as a staff member makes visual verbal contact with the parent or guardian. A staff member should walk the student to the parent or guardian's car, as we do not want parents to enter the office since they may be ill. Please give parents the What You Can Do at Home flyer to help families continue to monitor for COVID symptoms. Thank you for everything you're doing to help keep the DJUSD community safe. Contact your school nurse if you have any questions about assessing a student for illness.